Hello there, and welcome back to Diabetes Boot Camp. This is our sixth session in this series, and this one is all about trying to reducing the risks that are associated with diabetes in terms of long-term complications. So we'll talk a lot about the different types of screening recommendations that are suggested for persons with diabetes, but of course also take time to answer any questions that you have. For those of you that are new to the program, welcome. We have each of our sessions recorded and widely available in either Gainesville or Jacksonville campuses. If you got the invite to this session, you also are on our mailing list to get the uh, recording details sent to you as well. My name is John Bredenberg. I'm a diabetes care and education specialist based in Jacksonville. But as many of you know, we try to offer our programs to a wide range of audiences across the UF Health family, both in Jacksonville, Gainesville, and Central Florida. So I hope you'll learn a lot today. And as always, we are going to, open it up for questions. So if anything comes up along the way that is on your mind, feel free to drop it in the chat or strategically unmute yourself, and we'll be happy to answer those questions too. Now, for those of you that were here last week, I did give you another homework assignment. So again, the homework is really meant to help drive home the message. And I did want to collect it as feasible from you, but really what I was asking each of you to do is really just pay attention to blood sugar readings if you are already monitoring your blood sugar. So I sent out a pretty detailed blood glucose log, not requiring measurements at each of those time periods, because some of you may only be checking your blood glucose once a day or not at all, depending on what the doctor advised. So for those of you that were able to do the homework, or if it did apply to you, what'd you learn? What did those readings tell you? A lot of times if we're, measuring things, that's what we tend to manage. And that's the intent behind this particular homework assignment. I was hoping maybe you may have learned how different types of foods or activities or other issues in your life may have had a impact on your blood sugar. I know when we met before, I talked about all the different variables that go into impacting a person's blood sugar. So it's not just food, it's not just medication, it's not just exercise, but also stress and emotions and hormones and underlying illnesses are all other types of things that can affect our blood sugar. So it's important not to really wear the stress of elevated blood glucose too closely to your chest, meaning you don't want to beat yourself up unnecessarily, which is also the other reason we look and try to describe blood glucose levels as either within range or outside of the range, not really categorizing them as good or bad. Gail makes a good point there in the chat that eating late really affects you. Yeah, I mean, depending on what you eat too, you can see some residual impact on your blood sugar. When we look at nutrition variables, things like fat and protein content of meals can really cause what's known as a kind of like an afterburn effect, meaning you might have a fairly within range blood glucose levels a few hours after a high fat or high protein meal, but then maybe the next day you'll see a pretty sharp elevation. So again, a lot of the nutrients that we eat have different times that it takes for digestion and absorption. So it's not always immediate as it is with carbohydrates. So very good point. So again, just wanted to try to touch base on that homework assignment, explain the rationale behind it, and really trying to help you understand that when we look at diabetes self-management, just like we said from the outset, this is a job. It's a job that we really can't quit, and routine care, paying close attention to our blood sugar levels is essential for really lowering the risk of complications. Frankly speaking, your blood sugar level could be elevated right now. You may not feel it. And if we don't feel an acute sensation of pain, we may be less likely to really take action. But under the surface, as these blood glucose levels remain elevated, as we talked about, can really start to cause some damage to all the blood vessels in our body, which puts us at risk for stroke, puts us at risk for heart attack, for blindness, for kidney damage, for foot infections, as well as neuropathy or nerve damage. So what we're going to do today are talk about all the different things that you need to be aware of in terms of what type of tests and what type of screenings and what type of numbers you should be cognizant of as we try to care for ourselves on a daily basis. And I think it goes without saying, when we look at one of the most commonly ordered tests is the A1C test. So when we look at an A1C level, we want to make sure we're measuring that every 3 to 6 months. And again, when we look at all these different results, I'll get back to this slide here in a minute. So I'm going to fast forward here a little bit. When we look at the A1C level, we want to try to measure it every 3 to 6 months. Your doctor will set a target for you based on how that number is looking. If it's within range, they might only suggest it every 6 months. Or if there's been a change, or trying to look closely at a medication variable or any other aspect of your therapy that may have changed, they might measure it a little bit more frequently. That goal in terms of an A1C level is usually less than 7%. Some clinics may advocate a slightly lower target, maybe 6.5%, but really it's on a case-by-case basis. And when we look at what's going to be acceptable for A1C level, it's important to talk with your doctor as terms of what that number should look like. But remember, that A1C level is just an average, all right? So it's just an average blood glucose reading. It doesn't account for the spikes that we might see both on the top side and on the bottom side of our blood glucose spectrum, but it is something that we want to try to pay close attention to, and again, be aware of at least on a twice per year basis. The reason it matters and the reason you see it scrutinized so heavily is because what happens when it's outside of the range. If we look at various A1C level results, this is part of the landmark diabetes control and complications trial that looked at a number of factors as it relates to diabetes control and type 1 diabetes, again, a little bit different population than type 2. But what they found is as A1C levels elevated, beyond that 7% range, the relative risk for complications increased dramatically. And you can see it in terms of eye damage, kidney damage, nerve damage, and then, protein spilling into the urine. As that A1C level is above 9 and 10 and 11 and 12, it can almost increase the risk of complications 20-fold. So this is why it gets so much attention in the doctor's office. And again, it's something that we want to look closely at and see, okay, not whether it was good or bad, because again, we don't want to attach a value to that, but what we can do to try to move the needle if it is starting to move above that target that your doctor has established. What is it that we need to look at? Is it the medication? Is it nutrition? Is it activity? Or is it a combination of all three? What can we do differently to help us reach that target level? So the other area when we look at complications with diabetes that are quite common, more often than not, we see issues with the heart, whether it's through elevated blood pressure or progressing through to a heart attack or stroke. Diabetes and heart disease seem to go hand in hand. And that's because when there's too much sugar in our blood, those vessels that are carrying that blood start to become sticky. And through that stickiness, particles can easily collect and leads to that plaque buildup that we all know as arteriosclerosis. And this is where blood flow gets either stopped or impacted dramatically, and it can lead to blood clots and blockage of blood flow, which again, of course, leads to ultimately a heart attack and stroke. So when we look at trying to really minimize the risk of heart disease, it starts and ends with blood pressure. So many of us are familiar with what blood pressure is, but I like to use that rubber hose analogy and help you understand that when you turn that hose on full blast, those vessels, that hose starts to become stiff and becomes really tough to manipulate, really tough to bend. That's essentially what's going on with an elevated blood pressure. You're seeing an exertion of force against those artery walls. And as that force continues on a repetitive basis, it also starts to break down those blood vessels and tends to make them very brittle. And that's where we see, again, more issues with heart disease. The target for blood pressure is also carefully calculated by your healthcare team in relation to any other conditions or any other goals you might have. We generally see a target of less than 140/90 for most persons with diabetes, but if you have other risk factors or underlying high blood pressure already, your target might be a little bit lower than that. Just from a reference perspective, that normal blood pressure, as we like to say, is about 120/80. Anything above either of those numbers, and again, one isn't necessarily more important than the other, is going to be consistent with an at-risk level of blood pressure. Now, if a person is above that target range, this is where we look closely at those lifestyle changes that we've talked about in our nutrition and physical activity classes, as well as medication. And medication can be very, very effective at improving blood pressure, but it's maximized through those lifestyle changes. So if you are taking a blood pressure medication, but still following a diet that's high in sodium and high in added fats, you're not really getting the optimal impact from that medication. So what we often see with diabetes care is we want to treat to that target. Managing that blood pressure can be just as important to diabetes complication risks as managing that blood sugar. So taking medication as prescribed, being regularly active, and then paying a close attention to the food choices. Now, when Krupa, our dietitian, went over the nutrition components for diabetes, she talked a lot about a carbohydrate, and rightfully so, and how it can impact blood sugar levels. But with blood pressure, there's also some other variables to be mindful of with regards to diet. And there's actually two types of diets that have shown to be pretty favorable with helping improve blood pressure. And one of them is called the DASH diet. So that stands for dietary approaches to stop hypertension. So you see a lot of intake of plant-based foods, fruits, vegetables, high fiber intake, use of lower fat dairy products instead of full fat, and then a diet that's low in saturated fat and cholesterol. So what we see with this type of approach, which again, very low in saturated fat and minimal amount of fried foods and very minimal amount of sweets and added sugars, we see a reduction in blood pressure within about 2 weeks after starting. Also very effective at improving cardiovascular outcomes, and very similar, if you think about it, to the DASH diet is that Mediterranean diet. Oftentimes, when somebody will hear the word Mediterranean diet, we just think of red wine and olive oil. I use olive oil and I drink my wine. That's Mediterranean. Well, it's actually much more than that. And perhaps the most therapeutic part of the Mediterranean diet, when we look at cardiovascular health, is very similar to the DASH diet, and that's an abundance of fruits and vegetables. So I know I sound like a broken record when we talk about eating more plant-based foods as a way to help improve our cardiovascular outcomes, but there is so much research showing that it's most effective that it's hard to really ignore. So again, not every approach is going to work for everybody. The best type of nutrition approach is one you can sustain, but take a closer look at your diet and see where you can make some gradual improvements when we look at cardiovascular health, looking at the type of snacks that you're eating, looking at the types of meats that you're selecting and your portion size, and looking closely at those starches, just like we talked about with nutrition and diabetes. Those higher fiber or whole grain types of starches are not only going to be just as beneficial to your blood sugar, but also more favorable to controlling your cholesterol. And again, don't hesitate to jump in there with questions, type them in the chat if you want to dive deeper into any one of these topics. We have plenty of time today to get to any questions that might be on your mind. We spend a lot of time with diabetes talking about blood sugar, rightfully so, but I think oftentimes it's at the risk of ignoring blood pressure. And as I said before, managing the blood pressure can be just as important to complication risk as managing blood sugar. Just like checking your blood sugar helps keep us on track for diabetes care, so can checking your blood pressure. When we look at home monitoring devices, there's a whole host of different machines out there. Generally speaking, those devices that are automatically inflating, that you can purchase in the store and you place around your arm and press the button and it inflates, those are usually less prone to user error, meaning the old stethoscope and ones you inflate yourself. But again, doesn't mean one is more accurate than the other. We're just talking about what's more prone to user error. I do see that the upper arm placement machines tend to give more accurate readings than those that you put on your wrist. Um, Generally speaking, when we look at blood pressure management, but talk to your healthcare provider to see which device might work best for you. It is important to maintain some type of log so you can kind of look back and see what type of incidents might affect your blood pressure, whether it's the time of day or, what might be going on. You can kind of, again, problem solve elevations in blood pressure, just like you would with changes in your blood sugar reading. I will tell you this, according to the American Heart Association, they found that a lot of those publicly placed blood pressure machines, when you go to a Publix, or a CVS or a Walgreens, you see those, machines that you can just kind of sit down in. Those tend to be not as well maintained in terms of calibration. So those readings, generally speaking, are going to be less accurate than the ones that you might do on your own with your own purchase device. But again, that's not to say that they're all worthless, but it's something that you want to consider if you're somebody that needs to do more frequent monitoring of your blood pressure device. There are several fairly economical choices out there on the market. You can get one that's very accurate. We used one with a trial blood pressure management program here that I think was, just around $40 to $50 unit cost. So it can be pretty I think even less expensive if you look at some of those other retailers online for similar devices. So again, talk to your healthcare team to see if home monitoring of blood pressure might be something that you need to take part in. This is a measurement that really is going to be a staple of any doctor's visit. So every time you're going to the doctor, this is going to be measured, and it's something that you want to be aware of. Just don't be afraid. Hey, what was my number? What was my reading? Oftentimes the medical assistants, they're so busy that they may not have time to disclose those numbers. So don't be afraid to ask. Remember, diabetes, we have to take control and take charge of our care a lot of times. Another very important but sometimes misunderstood level that we're checking when we look at reducing our risk for complications has to do with cholesterol levels, also known as our lipid levels. So the ones that we pay closest attention to are subdivided into HDL and LDL. And, sometimes we get confused, like which one's good, which one's bad? Well, I've learned when I was in school that H is helpful and L is lousy. That's how you can keep them separate. If you want to know which one's good and which one's bad, do it that way. So the HDL is our good cholesterol and the LDL is our bad cholesterol. And I'm probably showing my age when I share this analogy with you, but think of your bloodstream as one big gigantic Pac-Man game. The HDL is the Pac-Man and the LDL are all those dots. So the higher your HDL, the more Pac-Man you have gobbling up all of that bad cholesterol throughout the body, which is why a higher HDL can be protective against heart disease because you have more Pac-Man circulating around, keeping things cleaned up. When we look at numbers in the lab setting, what we're looking for as far as targets can also be individualized based on risk. If you are somebody who does have a risk for heart disease, your healthcare team might want an LDL target even below 100, maybe something in the way of 80 to 70, and may use medications called statins to reach that target. But overall, generally speaking, for the different targets for those values, we're looking at 100 or less for LDL, the lousy cholesterol, and over, again, H is helpful, over 40 in men and over 50 in women. It tends to run a little bit higher in females. So that's why you see slightly different targets there. Those are the key numbers that we are typically looking at. Yeah, total cholesterol is important, but if we can break it down into HDL and LDL to see a little bit more about what's going on behind the scenes, that gives us a little bit more insight. The reason we scrutinize LDL so closely is that there's a very close relationship between LDL cholesterol and hardening of the arteries. This is just one study that was done that took a group of individuals and looked at what their LDL level was and their percentage of atherosclerosis among a patient population. So you can see here, this is the LDL level, all right, 70 to 80, 80 to 90, 90 to 100. And as it gets further up there, you can see the percentage of individuals with atherosclerosis. Okay, so again, a pretty direct correlation between increases in LDL and increases in atherosclerosis. And remember, that's just the code word of hardening of the arteries or those plaques that are forming along the blood vessel wall becoming more and more obstructive to our health and well-being. So that's why we pay very close attention. So you can see, in this particular study, no atherosclerosis when the LDL was between 50 and 60, and then it looked like one person when it was between 60 and 70. Then again, as I said, slowly creeping up as that LDL level goes up. All right, so there are other areas of the body that we screen for diabetes care. The other one that I think is often overlooked are the eyes. So if you're seeing a general practitioner for your diabetes, it's important that you remind them to get that referral or self-refer to an ophthalmologist for a routine eye exam. What this eye exam is going to do is examine the back of your eye, the retina, to see if there's been any damage. So remember, those blood sugar levels that remain elevated over a long period of time can cause a lot of damage to those blood vessels. And you can see that damage when you look behind that eye. And also, the health of the eyes, the circulation behind the eyes, is also a pretty good indicator of circulation elsewhere too, which is why seeing an eye doctor at least on an annual basis for that dilated eye exam can also give some insight as to what else might be going on. So think of the eyes as like the windows of the body looking into the overall circulation. Again, what we're looking at in terms of frequency really depends on what's being seen. It might be that you've had diabetes for several years and it really doesn't seem to, be any type of retinopathy present. So your healthcare team say, you know what, maybe just come in every 2 years. Or if they're noticing something, they can have you come in a little bit more frequently and also can treat it with either medications or in some cases, laser therapy. And the only way to really assess whether that's needed is through that routine eye exam. You don't want to wait until your vision is effective before you take action. So this is a very important screening because of the higher rates of blindness in adults with diabetes. Another very important screen that actually you can do on a daily basis is just your foot. Okay, those extremities are really impacted by nerve damage, and nowhere is it more evident than in our feet. Actually, it's our first line of defense when we look at assessment of how our nerves are functioning. So you can get an annual foot exam from a podiatrist, which can screen for circulation issues. They can use that little monofilament and assess for sensation and look closely at the integrity of the skin. But on a daily basis, I would really encourage you to check your feet every day. If you have trouble seeing the undersides of your foot, just use a little, cosmetic type mirror where you can see what's going on. Look closely for wounds or sores so we can see if they're healing appropriately. And if not, you want to call your doctor to make sure we get that attended to. It's also important to keep your feet clean and moisturized, just not between the toes, because that can really have a difficult time being absorbed and make it actually more moist between that area, which is also why you want to avoid soaking, because as they become too moist, that's skin integrity can start to break down and really cause more moisture to be lost as the feet are dried. And of course, avoid any sharp instruments on the skin, cutting, calluses, or anything like that. If you do have some mild calluses, talk to your podiatrist about how to care for that. Usually something like a pumice stone is typically recommended for individuals with diabetes. But again, keep an eye on those feet. If you have nerve damage and you step on something, you're not going to feel it So if you're not feeling it and you're not looking at it, you're not going to notice if an infection occurs. So this is where just a daily foot exam, changing those socks when you get home, keeping those feet dry and clean is a good way to try to help prevent any difficulties. Use a foot lotion, again, just to help with the moisture to keep the skin from breaking down too significantly. But again, you don't want to get it to a point where you're soaking that and again, aggravating the problem. So again, talk to your podiatrist about any issues with regards to warts and calluses, but more important than that, just when you get home tonight and every night, take a look underneath. What do you see? Is there a problem? Then we want to get it addressed almost immediately. The other part of our body that's really difficult to check on your own, which is part of your annual or semi-annual lab work, are kidney functions. So there's a few different lab tests that are typically used with diabetes care to assess how our kidneys work. Our kidneys filter all of the blood. They filter our waste products out, and if they're working, you're going to feel fine. But if they start to not work, then that's where we start to have issues. So looking at the urinary albumin to creatinine ratio, looking at our creatine levels, looking at our glomerular filtration rate, these are common values that are assessed and can be treated. So if we look at abnormalities in these ranges, if they're above certain targets, your doctor might actually prescribe certain types of blood pressure medications which seem to protect kidney function. So you might be given a prescription for something called lisinopril or another ACE inhibitor if your UACR is above a target range, because research has shown that this actually helps protect against kidney function. So again, you may not have it for blood pressure, but you do it for helping keep an eye on our overall health of our kidneys. So lastly, and certainly, of even greater importance now, and that is the mental side of diabetes. I think when we look at all the stigma associated with mental health and well-being, it's important to realize that depression is a medical condition and it requires medical attention. And this is something that you should not hesitate to discuss with your healthcare provider. People with diabetes are, more than twice as likely to have issues with depression, where you're losing interest in activities that used to bring you joy, and you're just not having you're having a difficult time mentally dealing with what's going on. Diabetes can also lead to a lot of stress and a lot of anxiety. Rightfully so. We're always being on. We're always having to care for what's being done about our diabetes. Maybe we're worried about some of the complications, and this can bleed out into some other issues with anxiety. Again, might require medication, but sometimes therapy for the anxiety, talking to somebody or doing relaxation exercises like yoga or going for a walk, investing in some you time, giving yourself some self-care, getting out and getting active can go a long way at helping manage some of that anxiety that we feel. The other term that's often used is something called diabetes distress. So it can be similar to depression or anxiety, but again, this is where we have exclusively issues dealing with all of the different diabetes issues, whether it's scheduling visits or checking our blood sugar or taking our insulin or changing our insulin pump or looking at our continuous glucose monitoring or remembering the types of medication. My advice here is focus on one or two management goals instead of everything at once, and really talk to your healthcare team. And when I talk about that healthcare team, I think one of the most underrated areas of that healthcare team is your diabetes educator. So somebody like me or anyone else as a diabetes care and education specialist can really help understand what's going on with you and where to focus your energies first. There are four key parts or four key times when to sit down with a diabetes educator. First, when you're first diagnosed, of course, to go over some of the therapy that's needed with diabetes, at least once a year, just as a check-in to see how things are going for you, to screen for some of those mental issues and some of the other issues that happen with diabetes care. If you experience any changes that affect your self-management, so any medication adjustments, if you're being started on insulin or any other change in therapy, that's when you also want to see a diabetes educator. or if you have a change in your living situation or your provider or insurance. These are all key times when it's important to go see a diabetes care and education specialist, which is why we also make it part of this program too. So I'm going to share with you a link that you can use to schedule your own diabetes education session with yours truly as part of this program. And through this program, we're able to offer this with no co-payment. So hopefully you'll each take advantage of that. It's not mandatory, but it's something that I would encourage you to do, especially since when we do a lot of these programs virtually, it's really tough for, sometimes you don't want to shout out your questions or ask statements in front of others. So that's what the one-on-one session's for. So wrapping up, as I said, any questions, go ahead and drop them in the chat, but I want to propose a few real life scenarios and see what we can do to troubleshoot some common issues when we look at reducing the risk. So let's say, your doctors are busy and you don't feel like you want to make suggestions to your doctor about your care. Maybe you can't do a proper foot exam because you have trouble reaching or seeing your feet, or maybe you have a tough time keeping up with the appointments and guidelines. So you might have some ideas that you want to share right now, some things to troubleshoot it, but here's a few right off the bat. First things first, when we look at all the different types of screenings that are done, every individual has the right to question what your provider is doing and what they do and do not recommend. A lot of times we're kind of rushed in and out of doctors' visits for a variety of reasons that might be outside of our control, but you have the right to question what your provider is doing. So don't be afraid to speak up. Say, hey, doc, I haven't seen a foot doctor in a while. Do you think I need to? Or what about the eye exam frequency for me? What's going to work best for me? Or how's my blood pressure looking? And this is your chance to make sure you understand that that's what they're there to do. Going to the foot issues, looking at a mirror or asking for help for someone to look at some of the feet, and then troubleshooting, keeping up with all the appointments and guidelines. Use a personal care record. So what we're going to be sending out today is just a simple downloadable personal care record that is kind of like your scorecard, if you will, of how often to measure certain things, how often to have them done and screened with regards to A1C, with regards to blood pressure, with regards to your lipids, your eyes, your kidney function, your dental visits, your feet assessment, all these things, and how frequently they should be done is going to be shared with you as well. So I know I've done a lot of talking. I'm going to stop the recording now and then opening up the chat for any additional questions. So I hope you will chime in then.